Ever noticed a tiny red spot on your skin and wondered, is this dangerous? You're not alone. These mysterious marks, called cherry angiomas, are incredibly common, but what are they? Are they harmful? And can you safely remove them? In this video, we're diving into the science behind these red dots, busting myths, and sharing dermatologist-approved tips to treat them. Stay tuned, you won't want to miss this. What is a cherry angioma and how can it be treated? Cherry angiomas are common, benign skin growths composed of small blood vessels. Also referred to as senile angiomas, Campbell-De Morgan spots, or cherry hemangiomas, they typically do not pose any health risks and usually do not require treatment. However, individuals may choose to have them removed for cosmetic reasons or if they bleed or change in appearance. Characteristics of cherry angiomas. Cherry angiomas typically appear as small, round to oval, bright red to dark red papules. They are usually measuring 2 to 4 millimeters in diameter, round or slightly raised, located on the torso, arms, legs, and sometimes the scalp. The name cherry refers to their red coloration and resemblance to small red fruit. They tend to increase in number and size with age and often appear in clusters. Terminology and classification. Cherry angiomas are often referred to interchangeably as cherry hemangiomas, though technically, hemangiomas are composed solely of blood vessels and are more common in infancy and early childhood. Senile angiomas, a term reflecting their frequent occurrence in older adults. Campbell-De Morgan spots, a historical term derived from the British surgeon who first documented them. Key distinction is that angiomas may contain both blood and lymphatic vessels, whereas hemangiomas are composed strictly of blood vessels. Prevalence. Cherry angiomas are extremely common in the general population. Clinical studies estimate that approximately 50% of adults over the age of 30 have at least one cherry angioma. To 75% of individuals over the age of 75 may present with multiple lesions. Their presence is considered a normal part of skin aging and is not typically associated with systemic disease. When to seek medical evaluation. While cherry angiomas are usually harmless, changes in their appearance, such as rapid growth, color change, ulceration, or spontaneous bleeding, should prompt evaluation by a healthcare provider. Such changes could, in rare instances, mimic more serious conditions including skin cancers. Removal options. Although treatment is not medically necessary, cherry angiomas can be removed for aesthetic purposes or due to irritation or bleeding. Common removal techniques include electrosurgery, cauterization, cryotherapy, freezing with liquid nitrogen, laser therapy, commonly pulse dye lasers, shave excision, surgical removal with a scalpel. These procedures are typically quick and performed under local anesthesia in a dermatology clinic. Causes of cherry angiomas. The exact cause of cherry angiomas remains unclear. However, research has identified several contributing factors that may be associated with their development, including advancing age. Cherry angiomas are more common in individuals over the age of 30 and tend to increase in number with age. Hormonal changes. Hormonal fluctuations, particularly during pregnancy, have been linked to the formation of cherry angiomas. Genetic predisposition. There appears to be a hereditary component as they can run in families. Exposure to certain chemicals. Substances such as topical nitrogen mustard, bromides, and butoxyethanol have been associated with the appearance of these vascular lesions in some cases. Do cherry angiomas itch? Cherry angiomas are typically asymptomatic and do not cause itching. If itching occurs in the area surrounding the angioma, it is important to avoid scratching as this may lead to irritation, bleeding, or secondary infection. Itching in the vicinity of a cherry angioma may be due to unrelated dermatologic conditions such as allergic reactions, acne, xerosis, dry skin, viral infections, e.g., chickenpox or shingles, persistent itching or discomfort should be evaluated by a healthcare provider to determine the underlying cause and appropriate treatment. Cherry angiomas during pregnancy. While the precise mechanisms are not fully understood, cherry angiomas are observed more frequently in pregnant individuals. This is believed to be due to hormonal changes, particularly elevated levels of prolactin, a hormone produced by the pituitary gland. These hormonal shifts may contribute to increased vascular proliferation in the skin. In many cases, cherry angiomas that develop during pregnancy regress spontaneously after childbirth without the need for medical intervention. When to consider removal. Although cherry angiomas are typically harmless and asymptomatic, you may choose to have them removed for cosmetic reasons or if they become irritated, bleed, or change in appearance. A board-certified dermatologist will assess the size, location, and number of lesions, your skin tone, and risk of pigmentation changes. The most suitable removal techniques such as electrocautery, laser therapy, cryosurgery, or shave excision. These procedures are generally safe, with minimal recovery time and low risk of scarring. How are cherry angiomas removed? Although cherry angiomas are benign and generally do not require treatment, some individuals choose to have them removed for cosmetic reasons or due to repeated irritation and bleeding, especially if the angioma is located in a high-contact area. Several dermatologic procedures are available to safely remove cherry angiomas. Electrocauterization. Electrocauterization involves using a small probe to deliver a controlled electric current that burns and destroys the angioma tissue. A grounding pad is typically placed on the patient's body during the procedure to protect the rest of the body from electrical effects. This technique is commonly used for small angiomas and allows for precise removal with minimal bleeding. Shave excision. Shave excision is a minor surgical procedure in which the angioma is carefully shaved off at the skin's surface using a surgical blade. Following excision, electrocautery may be applied to the site to control bleeding and promote hemostasis. This method is suitable for angiomas that protrude slightly above the skin surface. Cryosurgery. Cryosurgery utilizes liquid nitrogen to freeze and destroy the angioma. This technique is quick and minimally invasive, though multiple treatments may be required depending on the size and number of angiomas present. Laser therapy. Laser treatment is a widely used option for cherry angioma removal and involves targeting the lesion with concentrated beams of light that produce heat and destroy the blood vessels within the angioma. Common types of lasers used include pulse dye laser (PDL), intense pulse light (IPL), potassium titanophosphate (KTP) laser, NDUA laser, neodymium-doped yttrium aluminum garnet. A 2020 review found that the pulse dye laser (PDL) was preferred by patients due to its effectiveness and lower levels of procedure-related discomfort. Depending on the number and size of angiomas, 1 to 3 sessions may be required. Post-treatment considerations. Scarring is uncommon but can occur with any removal method. Mild bruising or temporary skin discoloration may result, especially after laser therapy. Individuals with darker skin tones may be at higher risk for post-inflammatory hyperpigmentation or hypopigmentation, particularly with certain types of lasers. It is important to consult a board-certified dermatologist to determine the most appropriate treatment method based on the location, number, and characteristics of the angiomas, as well as skin type. Will cherry angiomas return after removal? Cherry angiomas may reappear after removal, either in the same location or elsewhere on the skin. This recurrence is not uncommon and should not be a cause for concern, as cherry angiomas are benign and pose no health risks. If new lesions develop and are bothersome or cosmetically undesired, they can be removed using the same dermatologic methods. Can cherry angiomas be prevented? Because the exact cause of cherry angiomas remains unknown, there is currently no proven method for preventing their formation. However, certain environmental and chemical exposures have been linked to their development. To reduce your potential risk, it may be advisable to avoid topical nitrogen mustard, bromide compounds, butoxyethanol, a solvent found in some cleaning and industrial products. While these chemicals have been associated with angioma formation in specific contexts, avoiding them may help minimize risk, especially if you have a genetic predisposition. So there you have it, everything you need to know about cherry angiomas. Remember, while they're usually harmless, always consult a dermatologist before trying any removal method. If this video helped you, give it a like, subscribe for more skin health deep dives, and hit the bell so you never miss our expert-backed tips. Got questions or personal experiences with cherry angiomas? Drop them in the comments below. We love hearing from you. Thanks for watching and stay curious about your health. See you in the next video.